All right, the numbers are out. We now know what your Medicare premiums, deductibles, and copays will be for 2023, and I will go through and show you what Medicare will cost you in 2023. I'll be going over how much money you will need to pay out of your own pocket if you have Medicare. Now, these dollars will come in the form of premiums, which are the monthly dollars that you need to pay just to have coverage, whether you use it or not. Your out-of-pocket dollars will come in the form of copays and coinsurance. These are what you pay when you actually use the healthcare system. Now, before we get too far into this, we do videos like this all the time. So if you want to stay up to date on Medicare, be sure that you subscribe to our channel. If at the end of this video you found this helpful, consider giving it a like. Now, Medicare is not a one-size-fits-all approach, and there are a lot of variables in these costs depending on where you live. Now, we're going to go over what is most common based on the clients that we help and national statistics. Now, your costs will depend on how you fill in the gaps left by Original Medicare. The two most common options that we see are a Medicare Supplement Plan, specifically Plan G, and a Medicare Advantage Plan. So this video will show the costs related to those two options. So let's get this going. We have to start with Original Medicare, which is Part A and B. These are the same regardless of whether or not you choose a supplement plan or an advantage plan. So Part A is your hospital coverage, and according to the Centers for Medicare and Medicaid Services, or CMS, 99% of Americans have $0 premiums for Part A. This is because you or your spouse have contributed to the Medicare system for at least 40 quarters or 10 years throughout your life, so you do not have a premium. Part B does have a premium, and for the first time in about a decade, your Part B premium actually went down compared to last year. In 2023, the Part B premium is $164.90 per person per month, or $1,978.80 per year. Something to note, Part B premiums are based on your income from 2 years prior. So if you had a higher income, you will pay more per month for your Part B. It is called your Medicare Income Related Monthly Adjustment Amount, or IRMA, and here are the numbers for you in 2023. On the left are the income brackets depending on whether you file individually or jointly with a spouse. Wherever your income falls, move across to the right and you will see what your Part B premium would be per month per person in 2023. All right, those are your costs for Original Medicare, but Original Medicare leaves substantial gaps that most people cover with one of the two plans that we mentioned, a supplement plan or an advantage plan. Just to have the coverage of a supplement plan, you need to pay a monthly premium. This is highly dependent on where you live. In our area, the average for a Plan G is about $150 per person per month, or $1,800 per year. You need to pay this regardless of whether or not you have any medical costs. For an Advantage plan, it's a much different story. According to the Kaiser Family Foundation, 65% of Americans with an Advantage plan have $0 premiums. Yep, no monthly premium. Another 20% pay less than $49 per month. So 80% of Americans on Advantage plans are paying less than $49 per month. In our area, $0 plans are much more prevalent, and so that is what we're going to use in this comparison. The next thing to consider with Medicare is prescription drug coverage, which is Part D. If you go the supplement route, you would need to purchase drug coverage separately because it does not come included in the supplement plan. The average premium in 2022 was $33 per month, or $396 per year. Again, this is per person. Many Advantage plans have Part D prescription drug coverage included in your already $0 premium, so you don't need to pay any more for it. Now, moving on, there's a similar story with dental. If you want dental coverage, you would need to buy a plan separately if you went this supplement plan route. In our area, a dental plan is about $30 per person per month, or $360 per year. Most Advantage plans have at least basic dental included at no extra charge, so again, you don't have any extra dollars if you go the Advantage plan route. Finally, vision matches the narrative that we've been seeing, where you would need to purchase a vision plan separately if you want one. We're looking at about $12 per person per month, or $144 per year. Again, if you go the supplement plan route. Basic vision is typically included with Advantage plans at no extra cost. So now we can look at our total fixed costs for Medicare depending on which plan that we choose. Remember that with the exception of people on Medicaid, everyone has the Part B premium, so don't forget to add that in. With a supplement plan, you're looking at $389.90 per person per month in premiums, or $4,678.80 per year. With an Advantage plan, the Part B premium of $164.90 per month, or $1,978.80 per year. Now, if we were to stop right there, everyone would be choosing an Advantage plan. And for a growing number of people across the country, this is enough, and they are choosing Advantage plans. But this isn't the end of the conversation. We have to talk about your variable costs that depend on how much you use your plan and the healthcare system. So let's talk about that right now. Now, a deductible is the dollar amount that you need to pay before insurance will start helping at all. So with a Supplement Plan G in 2023, you have a $226 annual deductible that you would need to pay. Many Advantage plans do not have a deductible. Now, after your deductible is met, you may run into copays and coinsurance. Well, with a Supplement Plan G, you don't have copays and coinsurance. With an Advantage plan, you most definitely do. So for basically every service you use in the healthcare system and an Advantage plan, you would have a copay or coinsurance. Now, excess charges would be the money that you're responsible to pay if you visit an out-of-network doctor or hospital. With a Supplement Plan G, those are covered and you don't have excess charges. With an Advantage plan, you are confined to a network of doctors and hospitals. If you go outside of that network, you are responsible for either a much higher dollar amount or 100% of the cost of that doctor or facility, depending on the plan that you have. Now, when we talk about an out-of-pocket maximum, it doesn't apply to a Supplement Plan G. You pay your deductible, and then Plan G takes care of the rest for all Medicare-approved procedures and services. With an Advantage plan, you will pay those copays and coinsurance dollars up to an out-of-pocket maximum. The average in our area is about $5,500 for in-network services. There are areas of the country that are lower than this and areas that are higher. Our average is about $5,500 again for in-network services. If you go outside of network and start seeing excess charges, the numbers get much higher. So when we pull down the total cost-sharing numbers, we see a considerable discrepancy. So $226 per year for a Supplement Plan G, $5,500 per year or more if you go out of network for Advantage plans. Now, if this was the only part of the conversation that we focused on, everybody would choose supplement plans. And that's what some agents choose to focus on, and they don't look at both. Luckily, in this video, we are going to look at both sides of this conversation with fixed costs and variable costs. So let's look at the total risk with the Supplement Plan G versus the Advantage plan. So your total annual risk for a good year on a supplement plan where nothing goes wrong is the number that we had, $4,678.80. However, if you had a bad year where everything goes wrong and you need 2 or 3 or 100 surgeries, your annual cost is around $4,904.80. With an Advantage plan, if you have a good year where nothing goes wrong, you're looking at $1,978.80 per year, which is just your Part B premium. However, if you had a bad year where a lot goes wrong, you could be looking at $7,478.80 per year. So in a good year, you could save as much as $2,700 per year with an Advantage plan. In a bad year, you could lose as much as $2,574 per year on an Advantage plan versus a Supplement Plan G. Now, I've had this exact same discussion with countless people, and one of them that sticks out in my mind was with 2 family members who happened to be each other's sister-in-law. I went through these numbers and we showed them the differences of each of these plans, and one of them said, "Why wouldn't everybody get an Advantage plan?" The other sister said, "What are you talking about?" and kind of hit her and said, "Why wouldn't everybody get a supplement plan?" Now, the sister who liked Advantage plans pointed to the savings of an Advantage plan in a good year because her risk tolerance is high, and her assumption was that she would have more good years than bad years. She'd rather save the money in the good years and then put some aside for the bad years. The sister who liked the supplement plans looked at the bad year costs. Her brother had just gone through cancer and high-cost medical treatments. Her risk tolerance is low, and she would rather pay a fixed cost, whether she uses the plan or not, than worry about a bad year and coming up with the higher dollar amounts. So both are right. Supplement plans and Advantage plans are like comparing a Ford pickup with a Tesla. Both get you from one point to another. In this case, it's covering the gaps left by original Medicare, but they both accomplish this goal in very different ways. All right, there are 2 other asterisks that we need to address here. The first is Part D or drug coverage. Part D cost sharing amounts are not included in these numbers because Part D cost sharing is handled on its own, whether you choose a supplement plan or an Advantage plan. Most plans in 2023 have an annual deductible of $505. Again, you pay this amount first for your medications before your plan helps at all. After you pay this, you will also have copays and coinsurance amounts. And with Part D, there is no out-of-pocket maximum. Yet. In other words, you never have a dollar amount that you pay and then you don't have to pay anymore. This is supposed to change in 2025, but we aren't there yet. The other asterisk would be dental and vision. Much like Part D, these have their own cost-sharing numbers with deductibles, copays, and coinsurance that are outside of the numbers that are listed on these charts. Okay, you've made it through the overall costs here. If this was helpful, please throw in a like and a comment on what surprised you the most. Always work with an agent when making Medicare decisions. An agent can go through the plan options and make sure that you're getting the coverage that you want based on your risk tolerance and your financial situation. Agents cannot charge you for their services, so there is no reason to not use an agent. Just make sure that you are working with an agent that can represent both supplement and advantage plans, and they represent several different insurance companies that offer these plans, not just one. If you have this person in your life, please use them. If you don't, we are here to help. As always, I appreciate you and thank you for watching.